Il fait plus que 10 ans que Amsa Renal il arrive ici à Cécile et autres copies dans nos autres services. Aujourd'hui, bon matin, nous joignons avec des représentants que nous posons un petit peu sa parcours pendant ça 10 ans et aussi dans les autres services qui en ont pour autres offerts. Aujourd'hui, bon matin, pas nouveau, une figure assez familier qui nous voit. Il y en a une qui a 26 ans depuis là, ici à Cécile, une clinique en cause créole. C'est Dr. Rizvi et aussi Dr. Kuldeep qui peut joindre aujourd'hui bon matin. Good morning.
Morning.
Comment ça va?
Pas trop mal.
Pas trop mal?
Ouais.
Pour lundi bon matin.
Oui. Pour lundi bon matin.
Pour ça lundi bon matin. Dr. Singh, how are you?
I'm good.
You good?
Yeah.
For a Monday morning?
Monday morning, yeah. A week which starts and gives energy to work for a week.
Oh.
So always start with the week with a positive mind and thoughts so that it gives energy continues for 7 days.
How was your weekend?
It was nice.
Nice?
Yeah.
Dr. Weekend, tu passes bien?
Excellent. Not too bad.
Not too bad.
Thank you.
It's already 10 years
Yeah.
since you've been here in Seychelles,
Yeah.
as if it was tomorrow. It was yesterday, sorry. Just like that.
Yeah.
So what can you tell us through the past 10 years?
Past 10 years, it was a wonderful experience coming to Seychelles. When we came to Seychelles in 2015, the things were something different, but our continuous good services provided to the people of Seychelles, our motto was clear that providing good services and better services. I'm not going to compare the previous, new, but what is our services as Amsa? Vision was to give the good services and good health for all the people of Seychelles.
Was it difficult to settle at the first years?
See, always there will be a teething problem settling in anywhere of the part of the world if you go. But Seychelles is such an amazing place and the people are amazing. It doesn't give us any kind of more teething problem, but it's a very good, very good.
But the introduction and commitment of Amsa Renal Care in Seychelles, was it that good? Was it kind of acceptance for the people of Seychelles?
Well, I was not initially associated with Amsa Renal Care. I have only joined Amsa the last 2.5 years. So I think Mr. Singh would be in a better position to answer that.
Yeah. So last 10 years, we came here with for providing the dialysis services. So this was a part of the facility of our hospital as a association with the HCA. We came here and giving dialysis. At that time, there was 90 patients. 90 patients. Around 90 patients were there, but giving the best services. We brought the breast nephrologist, brought the nurses, technicians, and the support of our local nurses and HCA ministry. So with their support, the mortality rate was gone down, people feeling much better, and with their life expectancy has been increased. So now they are much better position in the care of the health.
What was the reaction?
Initially, people doesn't accept outsiders, but and now we are the part of their family. They accept us, they're part of the family.
Let's talk about the emphasis on preventive healthcare, like chronic diseases.
Doctor, you can
Dr.
tell us.
Rizvi.
Well, as you know, as you've always heard, prevention is better than cure. And unfortunately, in Seychelles, we do have high incidence of chronic diseases like diabetes and high blood pressure, leading to kidney problems. And there are, I'm not a nephrologist, but I can tell you that there are certain screening procedures, including regular physical checks, which can help to detect these conditions early enough and manage them well, so that there will be a prevention of development of kidney problems. Because once the kidneys fail, as you know, there is very few options. There are very few options, mainly dialysis and then this renal transplant. So in order to avoid those serious repercussions, it's better to prevent by screening for these, mainly these two conditions.
early detection is better.
Much
Absolutely.
better. So a regular test can keep you updated your health. Visit in every quarter with the nephrologist or the GP. They can show your results and they can guide you for if you need some extra care with the nephrologist.
We have questions from our viewers this morning. They are asking about how to get access to online appointments and booking.
Okay, Amsa Renal Care has a website. There you can go and book your appointment and the timing as per preferred your choice. So we are give the first priority to our patients. So as per their convenience of time, and the appointment can be booked with the doctors.
If not, they can walk in?
They can walk in.
They can walk in.
Yes.
Or give a call.
Give a call and walk in also.
Ok, bon di moun de la kou, si zot pe gen difficulté avec bon online appointment, zot kapab zis walking, ou men an petit call kote Amsa, et bon di moun ki la, ya va dirizou kote pou ale, apad fari ou pe di pou ki di, apad from dialyse, oui, zot fè aussi pour la santé, bonne madame, gynecologist, women's health as well, c'est ça, à cause Dr. Rizvi, il a aujourd'hui bon matin, apart from dialysis, they are talking about women's health, gynecologists, talk a little about signs of hormonal imbalance, pap smears, and painful menstruation.
My, that's,
That's
quite a lot for a Monday morning. But you asked me first about
hormonal imbalance.
imbalances. Well, as you know, there are a number of hormones in a human being's body. But when you talk about women, the main hormones we are concerned with are estrogen and progesterone, and a lot of times thyroid, very important,
Yes.
which can affect reproductive health as well. So we got to advise patients to watch out for signs of hormonal disturbances, symptoms of hormonal disturbances, which are mainly, the first thing would be a menstrual disturbance in the bleeding pattern, which is in the reproductive age group from, let's say, 12 until 55, 50 to 55. So that's a time when a woman would be expected to be menstruating. And there are disturbances which a lot of people wrongly think the number of days that a woman bleeds, or sometimes the smell, yes, of the, these are not the main things we have to look out for. Main thing would be the regularity of the period and the amount of flow in terms of clotting, heavy flow. Scanty flow is not really that important as long as it is regular. And then, of course, pain with periods is very important. Of course, pain is not uncommon with periods, but if it is very severe and gradually worsening, that is what we got to look out for. If somebody has had pain from the time they were, they started their periods, it's not maybe not necessarily a bad thing. But if there is any change and gradual worsening, that's when you got to seek help.
But Dr. Rizvi, what have you observed since you've been here in Seychelles regarding women's health?
Well, I think the most important thing would be the awareness that people have come to about their reproductive health. When I first came, it was not as, awareness was not, that common. And people have become more and more, I guess, through the Ministry of Health's campaigning, and especially as regards pap smears, which are which is one of the main screening methods for cancer in women, and breast awareness. So health awareness has definitely improved in Seychelles.
Questions from our viewers again. When should a woman start seeing a gynecologist?
Well, since, like I said, menstruation starts from 10 years onwards, sometimes even as early as 10 or even earlier. if there is a problem at that time, yes, a girl or a teenager can approach a GP or a gynecologist. However, they say after the onset of sexual activity, it is important to start seeing, not immediately, but at least in a year or 2 years' time from the onset of sexual activity, which can be at whatever age, because the legal age for sexual activity in Seychelles is 15 and above.
Yes.
So that's the time frame we're looking at.
What can you tell us about an overall sexual and reproductive health?
I'm sorry, I don't get the question. Overall?
Sexual and reproductive health. What can you tell us overall?
So, sexual health consists of not just sexually transmitted infections, STIs. It also consists of, problems with sexual awareness, sexual performance, sexual desire, and this obviously has a direct connection with hormones, but it can also be because of psychological problems, depression, anxiety, domestic strife. And reproductive health is a vast, everything else falls under that. So it's your fertility or infertility, as you can call it, inability to fall pregnant, then pregnancy itself, the labor, and then of course after this labor, which is the postpartum period, and very importantly contraception, which is also known as family planning. So you should have a pregnancy when you want it, when you plan it, not because you are not taking, not taking precautions to prevent an unplanned, unwanted pregnancy.
What are the major conditions that are affecting women's health?
Well, in the past 26 years, I found endometriosis to be a major problem.
Yes.
In Seychelles. Endometriosis has always been known as a women's disease of the affluent. In India, for instance, where I come from, endometriosis was very rare. There was tuberculosis, which was a problem, pelvic tuberculosis. But here, endometriosis is quite common.
Is it?
Yes. And of course, fibroids, uterine fibroids, which are non-cancerous tumors of the uterus, of the uterine muscle. And then, of course, infertility is there. Cervical and breast cancer is also a problem. But fortunately, we have a very good cervical cancer screening program. Recently, we launched alongside pap smears, we have launched the screening for high-risk HPV, which is human papillomavirus, HPV DNA detection, which is recommended, has been recommended by WHO and other international organizations as a means of more accurate screening for cervical cancer. And I believe recently Ministry of Health has also started it, but we pioneered it in Seychelles. And that helps by, if it is negative, for example, then one can repeat it only once in 5 years. You don't have to do it. I know in Seychelles there are women who want to do it every year.
Yes.
But you can't overdo it.
Yes.
The screening method is advised after a lot of studies that there is a certain period which is safe for repeating. So with this test, if it's co-tested with pap smear, if it's normal, 5 years interval is good enough.
5 years.
Yes.
But Dr. Rizvi, now that we are taking HPV vaccine, do we expect to see a change?
Oh, surely. HPV vaccine has been proven to reduce the incidence of infection with HPV, the human papilloma virus, the high risk types, because there are vaccines which are multivalent, which prevent, there are many strains of human papilloma virus, but the main ones are 16 and 18, which cause cervical cancer. And these vaccines help to develop antibodies in the woman's body and kill the virus before it takes root in the cervix.
On a la réponse pour les autres questions aujourd'hui. Bon matin. We come back to Mr. Singh now, back to Amsa Renal Care. What improvements has Amsa made in dialysis care over the past decade, and what is your future vision?
In the last 10 years, our focus, as I already told you, our focus was to providing the good care of services to the patients. So we are continuously learning in the new market of the products, which is much better than the previous generations. So we are trying to bring the best products for the dialysis services, and we are also providing good quality of the food to the people. We are giving them the training, our nurses, so that they can give better services to the patients. And we are also bringing some other changes also, like for the patient's knowledge, their understanding of the disease, lifestyle, because the dialysis patients comes every alternate day to the clinic for the 3 hours. So it's like their second home.
Yes.
So in last 10 years, we became the family member from all the patients who are coming to our clinic, and we are so associated, not only the medical care, emotional care is also important. So our nurses and technicians are well connected with the patients, and they when the patients comes to the clinic, they get mental support also from our nurses.
Can you give us a rough idea the cost of dialysis for one session?
It's a confidential agreement between the HCA
You're not going to tell me?
so yeah. So
our viewers can have an idea maybe.
Different part of the world having a different in good quality of services in any of the good country, it is around $300 to $350 as average cost if you are providing good services and the good quality of products.
10 years already.
Yes.
Dr. Singh, do you have new equipment?
We are bringing every time. So we are bringing, we are having around more than 50 machines. Dialysis machines, yeah. We are having in Mahe, we are having in Prale, we are having in Ladik. So that very 3-4 months back, we have opened a clinic with the support of HCA in Ladik. So there were people who are coming from Ladik to the Prale to taking the dialysis. So now we are in Ladik also. So the patients who are in Ladik, they can take dialysis in Ladik, our clinic.
You're on the move.
Yes. So they are very happy because sometimes sea is very rough. So moving from one place to another place, and the dialysis patients are very susceptible to the infection also. So it is good that they getting the dialysis in their island.
Well, let's talk a little bit about the contract with the Ministry of Health. Is it an open contract, or you have
No, we have a contract with the Ministry of Finance for the 10 years, and it is with the discussion with the ministry for the longer period.
Amsa is often seen supporting various community programs, and now that you have pledged 5 million donation to the Seychelles Hospital project. What is the current status?
Yeah. So last year, government Seychelles has come with a new hospital, which will provide the much better services and much more services. So Amsa will be contributing 5 million Seychelles rupees in next 10 years. So last year we have paid $500,000 Seychelles rupees, and again we are going to pay $500,000 Seychelles rupees very soon. You will see in the news.
It's good news.
Yeah.
For the people of Seychelles.
Yes. Our motto is always only focused on good services and happiness of the patients. Because if you are happy and getting the proper care, your life expectancy is going to increase. And when you are happy from inside, your atmosphere at home is also happy. Happy family.
One big happy family.
Yes.
Amsa, il fait 10 ans plus depuis les autres établis ici, c'est beaucoup d'autres, ils passent dans sa service et dans un nouveau service, nouveau équipement qu'ils ont permis aussi pour capable donner plus bon service. On arrive au Pralin, on arrive à la digue, il y a aussi Dr. Rizvi qui 26 ans. Il a avec nous qui encore peut demander sa service. Il y en a des gens qui peut demander Dr. Rizvi qui quantité gynécologiste qui en a dans Amsa.
Pour le moment, 10 mois, 10 ans.
10 Dr. Rizvi pour le moment.
Oui. C'est maintenant un plan pour augmenter at least one more because the demand is increasing and it will help us to. Of course, we do plan to expand our services to the surgical field, intermediate surgery at least, and in that case, we will need at least two.
Two more.
Yeah, at least one more. Well, two would be really good.
Justement pour provide parler avec la digue aussi.
Maybe possible.
Possibility
because yeah, we have to make a separate setup in Pralin at least.
Are they the nephrologists? Are they full time or part time?
We are having 5 nephrologists in Amsa Renal Care.
5.
1 in Ladig, 1 in Prale, and 3 in Mahe. So full-time nephrologist is coverage over there. We start our services since morning 5 a.m. and it goes up to sometime to 10 p.m. And we are more than 70 staff who is taking care of all the patients.
Wow.
Yeah, so full-time nephrologist is must required, and we are bringing more and more good talent to the country.
Is it enough?
Yeah, definitely. 5 nephrologists is sufficient.
Sufficient for the
Yes,
demands?
yes.
Voilà, un petit peu overview que nous pouvons causer. Dr. Rizvi, questions for you. Again, this morning, let's ask Dr. Rizvi an overview for birth control options.
Very good. I'm very glad you asked that question. First of all, for the general public, I'm sure they are aware, or sometimes some of them are not. There are family planning services offered by the Ministry of Health. Forever they've been offering it free of charge. However, in the private sector as well, there are all the options except I would say sterilization, which is not very readily available in private sector. But right from pills to injectables to implants, which is the latest modality,
Yes.
and the IUD. And I would really like to emphasize on the utility of the intrauterine device, which is really underutilized in Seychelles. It is available quite readily. I always promote this as the best method in the, after at least having had one child, because it is non-hormonal, easy to insert, easy to remove. Of course, it has side effects like every other method, but they are minimal, and after good counseling, one can easily utilize this. It is really underutilized in Seychelles. People don't even, they have not even heard of it from their healthcare providers, and they are quite shocked when I say that this is an option. And a lot of them accept it, and they're very happy with it.
Voilà. Pour la réponse aux autres questions, I have a question for you. Now that we are using desalinated water, does it have can it affect our daily lives?
Yeah, sometimes it is good to have a desalinated water, but some minerals which needs to be in the water, our body needs it. It should not go filtered. So our body also requires some kind of mineral which should have in the water. But desalinated water is not bad for the health. It is good, and providing we can't compare the natural water with the processed water.
The chlorinated water, you mean? The chlorinated water.
Chlorinated water is okay. That is also okay, not bad. And the natural water, which I am saying, that means the the rain harvesting water or the water which is natural provided from our hills. So that is better, but this is also not bad for our health.
But desalinated water is good, you say?
Not bad, not good. It's
not
okay.
Good, not bad.
Yeah, it's good. You can say.
But what does it do to our body?
It's not much affecting our.
Dr. Rizvi, do you want to add on that?
I think there are a lot of myths about
Yeah.
desalinated water.
Yes.
There is naturally going to be a suspicion about something which comes through a machine.
There are suspicion, Dr. Rizvi.
Sorry?
There are suspicion, yes.
Yes, but a lot of times they are unfounded. You know, a lot of countries in the world depend on desalinated water. That's their only source of potable water.
Yes.
That for drinking, for washing, for cooking, they have to depend on this. They don't have any natural, they don't get rain, they don't have groundwater. They have to depend on desalinated water. In fact, I was just reading yesterday, if they can get a power source to run these desalinated plants, desalination plants, they were looking at nuclear fusion plants, which would make it very cheap to desalinate water. You know, unfortunately or fortunately, Earth has, the majority of water on Earth is saline, which is in the form of seas and oceans. And it's a big, huge source without detriment to the environment. And I don't see why it cannot be used. Of course, like I said, there are suspicions about it not being good because it comes from machine, it's processed.
Yes.
However, you should remember that developed countries and a lot of the countries in the Gulf, for example, they are using and they will not use desalinated water if it was harmful for health. I'm sure the taste is different for sure, but there are some things which can be topped up like Mr. Singh was saying, like minerals that can be added to the water.
Voilà, la réponse pour votre question. We have a question from our viewers from Babette this morning. It's in Creole. Hi, Carol. A question pour Dr. Rizvi. Moi, j'ai 54 ans. Il y en a 3 ans et demi. Mon arrête voir mon période. Mais la semaine passée, mon ali vient retourner avec un symptôme normal, like la tête fait mal, des 3 jours avant qu'il m'ont un petit colique dans loin. Est-ce qu'il est normal ça après tout ça le temps, Dr. Rizvi?
So, premièrement, si période il panvini, puisqu'il est là. Puisqu'il est là, normalement, nous considérons ça y ménopause. OK. Pas 6 mois, pas 8 mois. 1 an at least. So, si sa madame il panwa période pour 3 ans,
3 ans, yes.
passé, après il commence à saigner là, it is called as postmenopausal bleeding. Fortunately, 95% of the cases of postmenopausal bleeding do not have an organic problem. Because hormones, estrogen, it's formed in other parts of the body. Especially if somebody is overweight, there can be some peripheral aromatization and some estrogen, which can stimulate the endometrium a little bit. Après, capable donne comme si par un period. Okay. Deuxièmement, atrophic endometrium. À cause sa lining da matrice, il pas par a reproductive age group, il fragile, delicate, il atrophy. It's gone, regressed from that original state. So, il est capable de temps en temps, not very commonly, but if there is some bleeding like this, if it's persistent, it needs at least an investigation, minimum a physical examination and an ultrasound. Il est capable de montrer nous qui grosseur il était sa endometrial lining. Si il est above un certain niveau, nous sommes capables d'investigate further comme si at least an endometrial biopsy, un critage, quelque chose. Après biopsy analysée, il peut montrer nous s'il y en a aucun affaire grave.
Et plus meilleur, il report, ça veut dire.
Définitivement.
plus meilleur au report pour regarder par le docteur inexpliqué. Nous pourrons retourner avec Mr. Singh et Dr. Rizvi. Ça pose publicité. Et voilà, quand nous répondons avec Dr. Singh et aussi Dr. Rizvi, quand nous continuons sa conversation, quand nous pouvons cause 10 ans plus depuis les Amsa Renal Care in Bercy, et là, on arrive CCL, on existe ici CCL, qui nous dépasse de sa bonne service, nous avons quelque chose qui m'a il était Dr. C, the more patient, the more money for you. What can you do to reduce this negativity of money coming in, money going out?
So see, we are not here for the money, or it's a part of business, but as I told you, the vision of Amsa is only to focus bringing the good services. So like in last 10 years, we were having in our services in the dialysis unit, but in last 2 years back, 2.5 years, we opened the Amsa Medical Center, where we brought the like Dr. Rizvi as a gynecologist, we have a Dr. Govindan for our pediatrician, one more pediatrician, Dr. Eva is with us, Dr. Karthik, who is the GP patient, and you can know that Amsa is providing the services, you can by imagine the number. In last 2 years, we have seen 23,000 patients.
23,000?
Yes, in 2 years, the visits, number of visits have been 23,000. So the kind of services, not only the dialysis services, we are providing the other services. So in general, health is also important if we can prevent them at the early stages. So they should not become the diabetic and the later stage as a renal care patient. So our motto is also to prevention. So the number should not increase. So we should try that. We are doing the campaigning for the prevention also. We are going to all the places, we are do the testing, and we do the clinics for the renal clinics, where we tell people that these things you always take care of them, your good food, habits, health, mental health is also very important.
Yes.
So we always tell them, so follow these practices, so you should not become the renal patients. So like we have a GP who always suggests for the diabetes. We have a nephrologist. They suggest for the what kind of foods you should take, what kind of exercise you should do, so that your blood sugar can be in control. See, our kidney failure are done when my sugar goes out of the control also. So these are stress and the diabetes are the major causes for our organ failures. So if we are taking care of them in starting, then we can control on that. So number of patients increase, we have got the more burden to provide more services.
More equipment's coming with the money. Somebody is asking, do you specialize in knee problems?
Not exactly directly, but our GP can guide them what they can meet with the ortho doctors, but in the preliminary stage, our GP can check and suggest. If required, they can said that this can be seen by the ortho doctors.
Orthopedic? You don't have orthopedics?
No, we don't have orthopedic doctor. Doctor, you would like to say something?
Would like to add to that?
Well, again, that is in the plan because there is a lot of demand for orthopedics. Knee problems is a very general term, but if it can be handled by the general physician, it will be. However, any serious problem will need an orthopedic surgeon, which we plan to bring.
In the future?
Yes, very soon.
Yes, good news. Dans le futur, il peut y avoir un orthopédique qui peut arriver, mais seulement il peut empêcher pour contacter Amsa pour les autres qui ont un premier, par exemple, nous dit préliminaire, un premier problème préliminaire. Et nous, si vous faites besoin de nous, nous déjà, Dr. Rizvi, déjà cause de hormonal imbalance, nous pouvons causer là plus bonheur et nous pouvons causer bonne medical services qui Amsa Renal Care il provide pendant ça 10 ans qu'ils ont provide, qu'ils sont encore là, qu'ils peuvent continuer. Il y en a oui, il y en a un nouveau équipement qui peut venir. Other medical services you want to offer in the near future?
We are also trying to bring ENT as our medical director, Dr. Rizvi, also suggests that ortho is also the next in our line. So we will have a line of services like gynecology, pediatrics, GP, ortho, ENT. In futures, very soon we are bringing all these services.
Dermatology.
And dermatologists also. Yeah, yeah. So we will bring in very in near future, because currently we are having one center at the town, and very soon we are going to open more centers so that the people get more services in other parts of the island.
Amsa is growing, they are expanding. In the next 5 years, we will see where Amsa is. Anything we have not touched, Dr. Singh, Dr. Rizvi?
Doctor.
Well, open to questions if you have any, because this is a lot to talk about if I can start.
You can give suggestions to the people for the prevention for
In
their
fact,
health.
there is somebody who's asked what, about the common fertility myths debunked. That's an interesting question.
I'm glad you asked that question. There are definitely a lot of myths.
Yes.
Because it's at the age of information, but it's also the age of misinformation.
Yes.
Okay. There are myths which have always been there, which are called old wives' tales, not misogynistic, but old wives' tales. And then there are now current day modern myths which are propagated by our media, which is not media in terms of TV, but social media.
Social media.
TikTok and Insta Reels.
People say that WhatsApp universities.
WhatsApp universities.
Yeah.
I didn't know.
Everyone is an expert, and if they can make a very slick video,
Yes.
with good lighting and good dialogue line, it's very convincing, and anybody can pretend to pose as a doctor. In fact, there are very few doctors who are actually going making these videos. Anyway, so the myths are, it's sometimes I find it difficult to bust those myths because they are so ingrained in people's thinking that I sound like to them that I'm crazy to be saying that this is not true. But I try to depend on evidence-based medicine, and which sometimes says that no, this is not true, this is a myth. The first one, for example, is that contraceptive use over a long time.
Yes.
Comme si you savez plus que 10 ans, il peut affecter la fertilité. Ou pas pour capable faire enfants. À cause il affecte le corps, il y a toxines, nous imaginer nous besoin faire detox. So a lot of times I get patients who say I have taken a break, and that's the time when they fall pregnant, and then they are in a desperate situation. So there is no scientific evidence for saying that long-term use of any kind of hormonal contraception will affect the fertility. So the fact that when they take that break for 3 months, they fall pregnant,
yes,
it means that it is not affected the fertility. Comprends? So that is a very important one. And then there are others about, again, my favorite contraceptive device, IUD, that it travels in the body. It can go here, there, everywhere, which is very rare, reported in medical journals as a strange thing, but it's not a common thing. Commonest is inadvertent pregnancy, failure of IUD, which is 1 in 200. So that is another thing, another myth, that the loop it's called a loop. Loop was the original device which came in. It's no longer a loop, it's a T or a multi-load shape. So those are the two very common things.
So all the myths canela dehors, pas nécessairement vrai. Pareil, Dr. Rizvi Indi, good morning. Carol asks doctor, when having sex after releasing, I get a pain on my right. Why is that?
Well, that would depend on how long she's been having that, and how long does it last. If it's of a recent, like within the last 2 weeks, 1 month, it could be an infection. Sometimes there can be a largish ovarian cyst, or if it's a chronic long-term thing, gradually worsening, like I said in the beginning, endometriosis has to be considered, you see. But usually, if it's a short-term thing, I would be thinking of pelvic infection.
But it's best to report.
Of course, if there is any concern, best to report. Especially if it doesn't become better on its own, like, you understand?
Et puis bon, au report, là, comment il y a un service available, back to the famous contraceptive pills, somebody is asking, does it affect the kidney or not?
No, it is not metabolized. It's metabolized in the liver, so it would not be affecting the kidney at all.
Non, aucun contraceptif, il n'a pas aucun effet. Là, nous voyons. Back to the Amsa renal care services in the early mornings. Does the Ministry of Health who provide the transport, or is it the Amsa renal care?
So, patients comes by their own, and the Ministry of Health is also bringing the patient to the hospital. So, our services start morning 5 a.m.
5 a.m.
5 a.m. So, the patients come by the Ministry's transport. Previously, Amsa was providing, but currently Ministry is providing transport to all the patients, and they come. For bringing all the staffs and other support services, Amsa is providing the transport to bring them to the hospitals.
Voilà la réponse pour votre question aujourd'hui bon matin. En autre mot, nous dit Amsa, il travaille en étroite collaboration avec Amsa Renal Care, côté dialyse et concerné, and they have been doing it for the last 10 years.
Yes.
And ongoing.
With the support of the people of Seychelles and Ministry, we are here and will continue providing our services till we are here in this place of land.
Voilà. Un petit peu, aujourd'hui, bon matin, nous petit peu cause avec représentant Amsa Renal Care, que nous petit peu cause un petit peu, bon service qu'ils ont donné pendant ça 10 ans, et là, qu'ils ont fait ongoing, il y a un nouveau quelque chose qu'ils ont fait emmener, ils sont capables d'aller d'autres pages Facebook page, WhatsApp, Instagram, and more. Facebook, WhatsApp, Instagram, Messenger.
Yeah. Definitely. We are having a Facebook page in Amsa Medical Center, Amsa Renal Care, and we have Instagram also. So people can connect with us in any form of the social media.
Voilà. Aujourd'hui, bon matin, c'est Dr. Rizvi avec Dr. Singh qui nous joignent pour nous cause 10 ans l'existence Amsa Renal Care, dans CCL et autres peut continuer dans sa service. Plus service in the future, plus l'équipement, nouveau équipement avec nouvelle technologie, tout ça là, les autres permettent, so why not? Donne un petit call côté Amsa Renal Care, walk-in, ou soit à les autres bonnes pages, ça gagne accès avec possibilité online bookings and appointments, c'est aussi capable de faire. Dr. Rizvi, beaucoup merci pour faire le temps pour venir nous aujourd'hui bon matin. Également, Dr. C, merci beaucoup pour faire le temps pour venir nous bon matin, pour nous venir donner un petit aperçu, 10 ans, qui ne passait pas de 10 ans, il y en a beaucoup de défis, oui, mais seulement, il y en a plus d'accomplissement.
Thank you so much.
Thank you so much. Et c'est ça, c'est une Topik. Konversasyon.